Hi. Hi, Joanna. Sorry, I've got a few windows open here.
Oh,
There we
hi,
go.
Miranda. Nice to see you. Yeah,
How are you this morning?
I'm doing wonderful. Thank you. How about yourself?
Great. Yeah.
Yeah.
Really excited that we were able to set this up kind of last minute.
Yeah. Yeah. I'm excited too. Sometimes like the inspiration and motivation comes and you got to run with it.
Let's just go.
Yeah.
We just talked on the phone just for a few minutes, and I don't even know what questions you have for me. I guess you emailed me a few,
Yeah.
but
So you want me to ask you a little bit about what you're doing?
sure.
Okay. Well, I see, by the way, you're in your lovely office and I see lots of really amazing and curious looking tinctures in there. So that's exciting to see. Well, I know that you've had quite a long career in the healing arts, and you started out with acupuncture, and you still, you do acupuncture, but you've sort of added things to your toolkit. So I wanted to ask you first about, from now your full experience professionally, um, what what is acupuncture sort of most useful for? When do you find that tool to be most helpful for people?
It's a great question. Well, as an acupuncturist for 18 years, I have seen people mostly for pain is why they come to me. And what I find is I'm most valuable to them probably for pain, because pain brings us to our knees, but also they find out the side effects of acupuncture are better sleep, which without sleep you die, right? And better digestion. Well, without digesting, you have no energy. And what comes from sleep and digestion issues all together is health. And I have, like, this is just one of the pathways. I'm just going to show you a poster that I put together about 15, 20 years ago. About organic acids. It's just, there are a lot of little arrows, right?
Right.
It's called Organic Acids in Central Energy Pathways, and it talks about where proteins come in and glucose, carbohydrates come in and fats come in, and how does the body work. And I put this all together to just make people realize it's not just like A, B, C, put a needle in and, your pain goes away. There's a lot to pain. Your nervous system God gave us pain so we would stop doing stupid things, get your foot out of that, bad place, right? And so what I do with acupuncture is I get people so they have less pain. Even having people calmer, if you're not anxious, 50% of your pain goes away. So if all I do is help with your anxiety, half your pain will go away. And then the next step is, well, why do you have the pain? And then we look at, how have you been walking? How have you been, and just all of these things come together with acupuncture that you wouldn't expect. If you are hunched like this all day, you're not going to breathe right. And if you're hunched like that, your back will, you'll start to affect the organs that are inside that skeleton. So,
can I ask you, Marina, because you showed us that lovely diagram, and you mentioned organic acids, and it's not actually a term that I was familiar with until sometime in the last year. I had an organic acids test, and I saw that they were talking about essentially the energy cycle. And can you explain that a little bit more, and how that interfaces with what acupuncture does for you?
Well, I put a sign here that said, note that food is always needed, right? So I think how you eat provides the proper balance so that now acupuncture can come in and give the nerves what they, enough of a, oh, wait, we're, you know, there's this, the brain is working in a certain way. It's like if you can imagine you're having a seizure, right? You know, you're a tick, your eye's ticking or something that your nervous system is doing because it's on overload. Okay. And the acupuncture needle comes in and says, hey, you know, just stop that one thing. You don't need to be twitching like that. Let's see what we can do. And so acupuncture can stop that kind of a twitch or that over drive that may underneath it all, you know, that, see this picture, okay, underneath it all, there's an imbalance, right? You've got a toxin that's targeted, or, you know, just maybe too many toxic people, right? Too many people screaming in your household. And here's a child and they start developing these symptoms of stress. And you have to say, well, okay, let's at least intervene with calm. Meditation would work, you know, a lot of calm, give the child a place to breathe. And then, wow, the liver starts to work better, so that toxin, even if it's coming from screaming, you know, the cortisol levels, that can be escorted out of the colon or the bladder, or sweated out. Or breathed out. In the case of alcohol, we know when somebody's been drinking alcohol, breathe out your toxins. So yeah, that's a good question about why did I even bring up organic acids? It was just kind of a random.
But it does show kind of your point that in order to have all of that work well, the sort of the energy cycle, the nervous system needs to be calm so that everything's sort of has the best chance of working effectively to help you heal. And
in fact, I just, yeah, I'm gonna say right here, I have the abstract of a couple abstracts. One, there's a meta study on acupuncture in 2020, so just a couple years ago, and they're finding, oh, acupuncture is very helpful for post-traumatic stress disorder, PTSD. And so the wonderful thing about this research is acupuncture that can affect the autonomic nervous system, right? We think automatic, your heart rate, your breathing. Well, you can kind of control your breathing, but you really, you know, it's not so easy to control your heart rate, but acupuncture can get your heart to just calm down. And then the prefrontal brain structures and the limbic brain inside, and it makes it able to relieve the symptom of PTSD. So that actually that gives me a reason to ask you a question.
Oh yeah.
So you gave me a book once when I was visiting you, and I didn't even know what book it was, but in the very front, on the front cover, you wrote that PTSD, that trauma, right? Oh, I didn't even write it down. So it was about chemical poisoning can look like PTSD, can look like trauma.
Oh yeah. Yeah.
And I figured you might be able to talk about that.
Yeah. So actually I've experienced that. I have had chemical exposures that left me sensitive to fragrances and chemicals that other people are able to tolerate more than I can. And I had a series, kind of a series of months where I had a bunch of exposures. I had to travel. I had somebody in my family pass away. And it was like on and on and on, these unexpected exposures, some even with people visiting my house. And I wasn't able to, really get away. I wasn't able to get away. I wasn't able to sort of troubleshoot in the way of, asserting what I needed and having those needs fulfilled. I just wasn't able to get away. And
so what were the chemical exposures?
So this is pesticides, fragrance products. Fragrance products are a really big deal.
Like their laundry detergent, right? They were using
laundry detergent. They can be very, very strong. So just my background is in, chemicals and consumer products and environmental toxins. Most recently, I wrote a book about this topic called Silent Winter, Our Chemical World and Chronic Illness. But I also, just in the last, thanks for that plug, Miranda. Just in the last month have been looking at some of the disclosures companies are making now under the law about what is in fragrance, and their lists are not yet complete. They don't have to finish until next year. But already I'm seeing things such as vinyl being used in products that are meant to, distribute in the air within the fragrance to make it stronger. Then there's other chemicals called phthalates, and all of these are just, really toxic chemicals that disrupt your system. And, I might be a more extreme case of this because I have less tolerance to these chemicals, but what's happening is that, the body is being exposed, and it knows that it's bad for it. So, my body knows that these chemicals are bad for me, but it's not able to get away. And so it's a trauma. It's almost like being repeatedly, hit or being repeatedly subject to very loud noises, that are startling, where it is a physical trauma. And so what I found in that time frame where I had a lot of exposures and I wasn't able to kind of isolate myself from that, is that my body, in addition to just dealing with those chemicals, it was shutting down in the same way that somebody with trauma or PTSD would shut down, to the point where I found myself, going out to the river, this was summer, people were swimming, and I'm in the river, I'm a very good swimmer, and I smelled somebody's cologne, and I felt my heart racing. I felt myself going into panic mode, and I had to get out of there because I felt like I was going to drown, and I had to go out and seek out ways to resolve the.
So that's the cortisol levels, right? It's almost like you didn't have enough cortisol, or the stress. From my perspective, I'm looking at is your the cortisone or these stress hormones are involved, and I found also with a lot of patients, right? They'll have this toxic exposure, and their adrenals get drained. And if we don't give them adrenal support and then a calm place and lots of sleep, I'm talking 12-hour nights, sleeping 17 hours or something, to just allow their adrenals to recover, then they go into this forevermore having trouble sleeping, and just their life is out of control.
Yeah, that's what I find that my body needs when I have exposures. Is suddenly I'm sleeping, at least 12 hours a day, and need naps, and I just need that. And by dealing with what you're talking about is addressing the nervous system level, I can relax a little bit, which means it opens up the possibility that I don't have to sleep as much. I can kind of cut back from 14 to 16 hours to 12 or 10. But it does, require more sleep. It sounds like you're saying to recharge those adrenals and
well, I noticed just from getting the shots and the booster, I'm now constantly needing cytosine adrenal, it's called AD, cytosine adrenal support. I work with biotics, but also standard process, and I'm finding a few people, it's the adrenals. Some people need other detox, but it's not the same for everybody. But to support whatever organ was hit by the toxic exposure, or viral exposure, or pseudovirome, in the case of a vaccine.
Yeah, and we have so many exposures now. We've got the vaccine issue, we've got the COVID, issue, whatever that.
Right. Yeah, getting COVID is pretty hard and kills a lot of people, and there's a reason for that, right? So
and then there's the environmental stuff. It's just we are really bombarded, and we do require more TLC, I think, these days. And so I really appreciate that you're doing that you're there. And in general, I do have to say, Miranda, that I feel in part that I owe so much of my health to you, because years ago you did introduce me to acupuncture and the alternative medicine route, which, you know, for me that's been 99% the way to go, you know, in terms of actually dealing with some of the very complex and chronic problems that more and more of us are developing. You have gone into nutrition response testing, and I think in maybe the last decade, I might be, my dates might be off, but I know you've been doing this for a significant amount of
10
time
years.
now. And so, I'd love it if you talk about sort of when is that, when do you use that, or how do you use it for people? How does it work? How's it helping people?
Yeah. Well, because mostly people don't know what nutrition response testing is, or even nutrition testing. They think it's blood testing or something like that. I generally see people for acupuncture first. And then sometimes I say, this isn't really, again, acupuncture may not help you that much. You're very healthy. You have good, you exercise a lot and you do yoga, but there's just, acupuncture will come in if we need to, move the energy in some way, right? But sometimes you have somebody like their whole back is spasming, but there's like spasm everywhere. It's like there's just the whole body needs something, and I'll get that hint, and then I can muscle test. So muscle testing is very simple. It seems it's very different from what your doctor generally did before they vaccinated you as a baby, whatever. But a healthy person, has a nervous system that can talk to that person and say, oh, when you drink that tea, you go hyper, and maybe that's not good for you because for 3 days you don't sleep, maybe you shouldn't drink that much caffeine. So a patient will come to me and I'll sense there's something really off. A 30-year-old mother of two would come to me, and she's had migraines, she's been on medications, and now she can't feel her fingers, she can't grasp, just a million different ways of presenting skin conditions that don't resolve. How could you imagine that a few acupuncture treatments would cure a lifetime of eczema? You just don't. And so we look at how do we unwind these chronic problems. So, I like your book. Again, Silent Winter is about our chemical world and chronic illness. What is chronic illness? I have a book, Strangers in Their Own Land, I'm reading right now. What is causing people to be generations of cancer? And then I have Fateful Harvest. I'm just some of the books, Fateful Harvest by Duff Wilson. Just realizing the people in these stories have all been exposed to toxins and chemicals and pharmaceuticals at high levels that damage their livers. And so I find, okay, how do we, looking at these pathways, you don't have energy, you can't grasp, your hand doesn't have energy to grasp something. Let's look at maybe there's some food that we can do, because you are a self-healing machine. And the only thing that can heal you is nature. Okay. You can add drugs, good luck, maybe you can push the system. You're always pushing the autonomic nervous system to do what that doctor said you need to do. We need you to not be depressed. So you take an antidepressant, but it causes more suicides, and antidepressants have side effects. Okay. And it's well known that there are more suicides on antidepressants that are on, than you have suicides if the person is not taking antidepressants. I mean, is it correlation, whatever.
Mhm.
So we want to help this patient in front of me. And I have only whole food supplements, some nutraceuticals, and there's a difference. Nutraceuticals are still have some pharmaceutical issues with them. So they're not whole food. So we want to look at, what does your body need? Can you digest food? Sometimes you can't. Then we use homeopathy. I've found a lot of times when the body would benefit from homeopathy, I can identify also a simple nutrient that could help that body recover from the issue. But the answer to your question is simply, if the issue is complex and the issue looks like there's a nutritional deficiency, if it looks like we need to help the liver go from pathway A to there's different phases of detox in the liver. If there's some blockage there, sometimes the liver doesn't have that missing piece, here somewhere in the pathway. And one of my colleagues wrote a book, The Missing Piece, about nutrition response testing. But again, the most important thing to know is that you can heal with the proper supplement possibly, or proper food. And the Chinese medicine doctors, they had really good, they categorized this very well. But I found that the Chinese herbs weren't so effective for my patients. My patients do really well with whole foods and whole food supplements.
Wow. And I know that, you've given me some nutrition response testing sessions. And I know that there's this piece of it where you're actually doing muscle testing. And, but I remember from that experience that it's not necessarily that simple. Like sometimes your nervous system might be off, and so you're not testing properly, and there's some things need to be fixed first. Can you elaborate on that a little bit?
Yeah, I don't think you ever came to my office.
I remember I was at your place during you were doing a workshop on muscle testing.
Okay, that was like 10 years ago.
Testing. I don't know if you remember that.
Okay, yeah. So 8 years ago, maybe.
Yeah, it's amazing. It's just terrible how fast time passes. It's ridiculous. But,
yeah, I've learned a lot in the last 8 years. So, and even 10. But so with muscle testing, there are different people, have different amounts of experience. It took me 3 years to be able to muscle test almost everybody effectively. Initially, it was really hard to figure out what was a yes and what was a no on certain people. And I noticed that was if they had a lot of heavy metal toxicity, their nervous system just wasn't, it was just really hard to figure out what did their body really need. And so there was a lot of confusion in their system. We call that switching, when there's confusion in the system. And you might even take a supplement that would help them, but because of the confusion, it doesn't really work right. Like it's like turning a switch on and off, lights on, lights off, lights. Sometimes the nervous system isn't getting the information. So I found it was impossible to treat somebody outside of my office because I needed to have all of my tools. But one of the tools I have now is something that identifies autonomic nervous system confusion. And when we just address head on what is the number one issue there, what or number 1 and 2, then everything else starts to fall into place. And that's why I think a lot of my colleagues are so anti-drug and even nutraceutical. They're anti-pharmaceutical, anti-nutraceutical, because if you're interfering with the nervous system, you better know what you're doing. And that's medicine. Okay. If you do nutrition, you are giving the body, okay, liver, you can identify with muscle testing that the liver needs Livoplex or choline or cholesterol, maybe just bile salts, something to move the process on. And when you get that going, then the body can heal itself.
But it sounds like it's very, with the muscle testing, it can be tricky, because sometimes I've seen people say, oh, just try it at home, do a little muscle testing yourself, whether you should eat this or that. But it sounds like you can be misled, actually.
I cannot muscle test myself. I do not muscle test myself, and I don't trust everybody to muscle test for me. Yeah. So and there may be times when the person who is muscle testing you, when your gut says this isn't working right, trust your gut and, give that person a break. That, we're all human beings. So let me think about this. There was, I was dealing with a toxin or something I had been eating. And it was almost like for 3 days. Yeah, I wasn't that effective, especially for certain people. And then they came back a week later and said, oh, I had, all of my old symptoms started returning. So I knew, okay, I wasn't being as effective. So I'm always now getting checked every Monday morning to make sure that my nervous system is as healthy as possible so I can test. And that's why I'm on, 2 adrenal supports. I mean, it's amazing what I've needed to do just to be vaccinated. First to recover from COVID, because I did get it even before March of 2020. And then when faced with the vaccine, I've just needed constant adrenal support. So if I stay on that, I'm a very healthy individual. I can ski 25 miles as long as I rest afterwards. So what you say about muscle testing is valid. You need to, but it is the only way I have found for me to heal, because I'm so sensitive and I don't like this hit or miss trying. I think you've tried zeolite. If I take something like that and it takes out all of my minerals, well, I have a full-time job. I cannot take a week off and rest. I cannot afford to take supplements that take my system out. And so there's no playing around here. I need something today that's going to help me today. And if you have a muscle tester who can help you with the proper nutrients, your nervous system can literally regulate in seconds, just like acupuncture. In 6 seconds, your pain goes away. With supplements, the same thing. You take it, you put it under your tongue, you eat it. I have patients who come in here, they're absolutely horrid migraines. And 2 hours later, a lady the other day, she says, I'm going to kill myself if I leave and I still have this migraine. I've had it for a month. And within an hour, she's had the supplements. I said, take these and I'll test you in an hour. I tested her 40 minutes later and I gave her a couple more of different supplements and we got her nervous system regulated. Oh, she kind of forgot she had a headache. She was hungry. I need to go. I need to eat. So I let her go. Otherwise, she would still be in my office. I don't let people kill themselves.
Yeah. Yeah. And I know what you mean. I've had a lot of recommendations to take like activated charcoal and carbon. And, I can do that in a crisis, like I have food poisoning, but it does drain me of minerals. Zeolite, I haven't felt that issue, thankfully. I do a supplement routine, I totally subscribe to what you're saying. I wanted to ask you, kind of backtrack, about the vaccine thing. And I know that this is a very contentious topic because we all want this COVID thing to go away. And we have recommendations from the CDC and WHO and a lot of other agencies to do the vaccinations, and a lot of us are getting vaccinated, for work, or because of our concern of the spread of COVID, and a number of us, other of us can't really do the vaccine. We have some health issues, or we've had COVID, we've had complications, whatever it is. So, and historically, I know that vaccines come with risk. And so I was wondering if you're able to talk a little bit about, vaccine in the time of COVID, and what can people do, especially if someone wants to take the vaccine or feels like they need to take the vaccine just because there's so much pressure. What advice can you give to them?
Yeah. So I live in Seattle. 99% of my patients decided to get vaccinated. So I was here to make them as healthy as possible before they got vaccinated. I had a family where this one mother, I just didn't think it was really the right time for her to get the vaccine, because she couldn't hold a pen, she needed to heal. So the family all got vaccinated, and I just gave them the support for dealing with the adjuvant, the graphene oxide, and when you get the vaccine, a lot of times you'll see prions, but you get that from having COVID as well. So a lot of people in our society now already are showing up with the prion disease, which is folded proteins that can really mess with your brain. But also the spike proteins. The spike proteins are what we know from this monkey virus that thickens the blood. You can get a stroke. You can have heart attacks from COVID and as well from the vaccine, but not as badly. But what I would see would be the need for vitamin E. I use standard process Cataplex E mostly, sometimes wheat germ oil, which has a lot of vitamin E, whole food vitamin E, to help with the blood vessels. Now, the pharmaceutical, the nutraceutical alpha, what's vitamin E? Alpha tocopherol, right? That would probably cause more heart attacks and more strokes. It's not the right thing. You need whole food vitamin E. So Cataplex E from standard process is what we noticed started testing in January of 2020, like my colleague and I are like, what is up? We never used to need vitamin, Cataplex E, and now everybody needs it. And then it turns out, that's what our body is craving, because we're trying to deal with this thickened blood from the spike protein. Wow. So I'm here to just give the bodies that come in here, the people, what they need for their body, their mind. I mean, if your system is like this, you're obviously going to feel anxious. So all of that together, I have very healthy vaccinated patients. I guess I'm good because I ski 25 miles. Maybe that's another reason my adrenals are sometimes stressed.
I'm sure that brings a lot of positive benefits to you as well.
I just could ski till I drop. That's, that's just, I guess, maybe my exercise addiction, but I have to, rest too. And so I get to do everything. It's fun. That's what's life. I mean, life's to live. Ultimately, I'm here to help you live your life. If you need to get vaccinated, get vaccinated. If you don't need to get vaccinated, I mean, you might be living in the middle of nowhere. So you don't need to worry about getting COVID. So just stay away from people, and eventually this is going to blow over. The Omicron, I love how my friend called it Omicron. It's getting smaller, right? It's getting weaker and weaker. It's now, especially my vaccinated patients are just getting the flu. And then this patient who couldn't grasp, who didn't get vaccinated, she got it. And, interestingly, she said the Omicron variant that she got unvaccinated. She's like, well, I actually feel worse when I'm detoxing. She told me, she's like, I actually don't feel so bad with this, Omicron. So it's nice to know that, we didn't have to give her heavy drugs more to detox after all of the migraine medication detox. That was worse. Okay.
Interesting.
Yeah.
So I know, Miranda, you've been working with morphogenic fields in sort of recent times. And can you explain a little bit about that and how that sort of?
Well, pardon me while I go get a picture.
Okay.
So my teacher drew this beautiful thing. So a morphogenic field looks like the gravitational pull around the earth, or an apple, or in a person. Okay. And there's Kirlian photography takes pictures of how the electrons come off of our body. And so we have a lot of molecules, right? We're made of substance, right? So because of that, there's a field. If you're a healthy person, your field is really big. So a lot of people are learning about heart rate variability. What is that? It's the biggest thing right now, like, collagen or something. So if you have a really variable heart rate, you're able to adapt to the environment. Like something, snaps and okay, I can jump and go 100 miles an hour and get away from that. Or, there's some soothing music and right away you get soothed and your heart rate is calm and you relax. Everything's happy. You take a deep breath. And so that ability for your heart to rest, deeply rest in between that quick go, is a sign of vitality. It's a sign of how long you're going to live. And from what I understand, now they have a ring, you can see that your heart rate variability is going up and down all day, right? Sometimes you're going to die, and sometimes you're not going to die, right? So it's kind of like whatever. But really, that's your field. When you have a really good heart rate variability is when your field is bigger. And we can see that the bigger the field, the more vital and fit and healthy you are. And so the morphogenic field technique that I learned from Dr. Springab, and he was inspired by one of his staff members even, who suggested, why don't we work with a field? It's just another technique of muscle testing. I've just had better success with having more tools in the last 3-4 years. The best example is a patient who came to me with colitis, and there's no drug that could help her. And her friends were injecting, monthly injections for colitis, and this hadn't helped her. And the best improvement she made was from my colleague working with her diet and doing nutrition response testing, but my colleague gave up and she said, Miranda, can you try with morphogenic field technique? And so what was great about using the field was it was much more specific in saying, really only give her 1 or 2 things. Okay, I only gave her 1 or 2 supplements. The most important, and the field is able to identify the most important. So when you pretend this is kryptonite and I'm Superman, right? When this comes into my field and my arm goes weak, right? It's like, get that away. And so when you even just pulling it away, the arm starts to stay strong. So if I pulled a substance away from this lady who had colitis and her arm would stay strong, I would say, why am I giving her that? So it's a final test. You test the field, and her field was very small, right? There's no fitness. She was waking up 100 times a night and having to poop, like, where did this come from? Like, there's not enough food in her day because she's just pooping all day, all night. Okay. And then, so let's say cytozyme adrenal. Okay. Let's see. Does she need it? Her arm was strong when I took it away. She doesn't need it. And that way I could identify of the 16 things, that she might have been attracted to initially. It was just kind of a scratch and sniff. Nope, don't want it, give it away. And then, so she'd come back, and for a little while, I needed to see her twice a week. And, it was only like after 2 or 3 weeks, Miranda, I slept through the night. I didn't have to get up and poop. I'm making it. And now she's making it till 5 a.m. She has solid poops. Now that is really, really important because if you're not absorbing your food, you're going to die. And if you don't sleep, you're going to die. So, and that's, my acupuncture teacher who treated cancer. She was like, number one, bowels and sleep. You need those two for health. And if a patient says either of those, they're on my list we might need to do nutrition testing on you. And I think right now I'm doing 10% nutrition response testing and 90% morphogenic field technique. Not that that matters. I think that's going to change as I get better and more experience. But right now I'm helping almost everybody. It's just fun.
That's exciting. Yeah. Now, so last time I saw you, you had, I think you mentioned you have 2 offices now. Is that?
No, I closed the Federal Way office.
Okay, so you tell us where you're located.
I'm in West Seattle. I've been here since 2003. And what do you want to know about my office?
Well, I know it's in West Seattle, and I think that was the most important part because I knew you had this other office, and I've been to your West Seattle office. It's beautiful, very Zen experience, and I can see you've got some bottles behind you. Is that part of the? I know you use some standard process for nutritional response testing. Is that?
This is energetics. The most common thing I use for energetics is when somebody has radiation toxicity. I really have been using much less of the homeopathics lately, because when I have people hold those remedies, it almost is like, okay, this is great. This would help me and I'd feel better, and they do. But what's the nutrition that I need? So while they're holding this, I'll start testing all of the other nutrients. And it's almost like the homeopathic it strengthens the field enough to help me identify what's the nutrient to help the liver. It strengthens the field enough. It's just electronic. It's just right? Homeopathy is just molecules moving in a certain way. Right? It's the toxins of bee venom diluted to the point where there's no bee venom in there, but it helps your immune system say, oh, I'm gonna not react so much to that bee sting. But when somebody holds that supplement, sometimes we can find, and I'm interested now that we have the zeolite, and standard process has something called GI. Anyway, it has a zeolite product. Okay, it's we weren't able to use the bentonite clay anymore because it was being irradiated or somehow, we weren't. Bentonite clay is now no longer a safe product.
Wow, that's good to know, because it's very popular thing that's just kind of available relatively widely. So I think
it's well, it's just not testing that well anymore.
Right. It's kind of like turmeric, everybody thought it was, oh, turmeric's so great and everybody's taking it. And then I saw there was actually some I think some lawsuit in Seattle actually about, kids being poisoned with lead and turmeric. So yeah, I think it's so important to be careful and know where your stuff is coming from.
Well, the lead was probably placed there in order to sell turmeric at prices, oh, this is cheap turmeric, right? It's greed.
Mhm.
I really, your book made me more aware of how bad things have gotten. I mean, what's the difference between Silent Spring and Silent Winter in a nutshell?
Yeah, well, Rachel Carson wrote Silent Spring in the 1960s, and most of it was about the impacts of pesticides on wildlife. But she had a very short chapter, about 10 pages, that talked about what she was seeing and what she envisioned would be the human health impacts, so impacts on us. And so she mentioned, our energy levels, the impacts it could have on our abilities to sort of fuel our bodies, and also the impacts on our liver. And it was just enough for me to start thinking about, well, what do we know now 60 years later about the human health impacts? So basically, I took her efforts, those initial efforts of her work, and looked at 60 years later, what's the evidence on the human health impacts of toxic chemicals? And on top of it, we've had, an exponential growth in use of these chemicals in consumer products. The amount of pesticides that we've used has just proliferated as well. So, and the evidence is basically, yeah. And then we've got Fateful Harvest, which talked about just how much heavy metals and, even radioactive material and everything in between that's found in commercial fertilizers that's affecting our food. So, we are being bombarded, and it is having very serious consequences on our health. And that's why so many of us are having chronic health issues. And unfortunately, the conventional medical establishment they don't understand how to treat them, but they don't even understand what the problem is, that the problem is that we are being bombarded from our environment, and from, we should be getting clean food and clean water and clean air, but we're not getting that. And that is leading to, our immune system problems, and why we're getting sick, and why we have chronic illnesses. And, I'm at a point personally where I don't even use my health insurance anymore for conventional medicine. I'm putting my resources and anything that's possible out of insurance to visiting individuals such as yourself to get the support that I need in our chemical world. But I would also, love to see people know what choices they have in terms of avoiding a lot of toxins, because, you can keep getting support from somebody, going to Miranda Taylor, for example. You can keep getting the support, but if you keep dumping that stuff into your body, it's going to be this ongoing battle. But you can actually heal if you know that, okay, I can just get these things out of my life, and that'll make a difference for me as well.
Cool. In the back of my mind, I'm sure there's something else that you'd like to cover, so I want to make sure you cover that. But I do have a question based on strangers in their own land, okay? Because we all feel like strangers in our own land. Our country is doing things. I mean, why would we be putting heavy metals in our food supply, in our soil, right? It's like, okay, it's called recycling, and the EPA allows it. And what is the EPA? So actually, this is one of my questions. Who determines what's polluted anymore? Like, like if something's polluted, like when do we not grow food in a place anymore?
Mm-hmm. So unfortunately, this is it's a very emotionally difficult topic, I think, for all of us to really look at, because we are living in a polluted world, and our industry and our government, they're kind of two peas in a pod these days. It's been like that for a while, but that's a reality that
Well, my best friend, a police officer, okay, not best friend, but one of my good friends is a police officer, and I even talked to him this morning. I said, please ground me for this interview because you're an enforcer, right? How does it happen? And well, he says the squeaky wheel gets the grease. If you have money, right, you're a squeaky wheel.
Yeah.
And our government is limited. They really don't have the energy. There's not really that many people. And that's another thing in this book, Strangers in Their Own Land, is like a lot of people who are anti-regulation think that 40% of our country works for the government. And that's really not true. It's like 1%. We don't have people to enforce pollution laws.
Yeah, we don't. And in fact, our government relies on industry to tell it what's toxic and what's not, what's safe levels and what's not. And another thing that happens is that as we become more polluted, we increase our threshold of tolerance. So, for example, we might have said in the past that we don't tolerate any, let's say forever chemicals in water, but now
well, this is tolerance on paper. This is not our bodies tolerating
this
it.
is not
this is just
body
on paper.
This is sort of the regulatory tolerance. So before we didn't tolerate any of it, but now, as it turns out, we have a certain amount of PFAS or forever chemicals in our water, and so the government's going to raise the legal tolerance because what is it going to do if it stays low and we're above? Then suddenly the companies who are polluting are going to be liable, right? But they don't want to be liable, so they go back, they go through the back door in government and say raise the tolerance. And we see that in food as well. And so if you look at some of the charts of what are the tolerable levels of whatever it is, a pesticide or a heavy metal in foods, they're all over the map. The numbers don't even make any sense because they're not driven by the science, and what scientists are telling us. They're driven by what companies want in order to stay out of trouble. So, the question of who decides is, unfortunately, it's not a happy question. And it goes back to, when I was in law school, there was this term that we learned, which was buyer beware. And it's been taken to the next level where it's really up to us to educate ourselves, to know what's healthy for us, what's not, to know, that we're not being protected in a sense, so that we can, we need to take that responsibility ourselves, fortunately or unfortunately, that's our reality.
And we are also part of a larger society, okay? As an acupuncturist, I have West Seattle. I want to take care of West Seattle, right? And so when I'm out in the world, what I say is important. And what I need to say is, first, let's look at the people right here, what we are dumping. We need to take care of the people who are dumping raw sewage. We need to take care of the industries in South Park. I'm smelling some really funky things. I need to be a squeaky wheel, and not all the time, and not like in paranoia freak out, that's word is overused too much, but not in fear. I mean, I have the tools, right, to deal with anything. I have patients come in here with really terrible health conditions because they grew up on a superfund site on a military base. Okay, a lot of their parents' generation is dying or dead of cancer, and they come with eczema because they were children when they got exposed. And I can tell you all of the chemicals in their body before they tell me what was on their particular superfund site where they grew up. Okay, wow. So I know I have validation that what I'm doing can identify the chemical, and that we slowly can take those knots and unwind those knots and take those chemicals out like a rope And it's just like, you know, mercury, the most toxic perhaps first. I don't know what comes first, but they just one metal after the next goes out. Like a long rope, and it doesn't go out all at once. Our body cannot detox everything at once. The one thing, you know, a bad detox and too much detox at once can feel worse than COVID. Right? I've heard it from my own patients. So I'm not pushing anymore. I'm now just allowing the patient to pull that thread on their own. But, you know, looking at, okay, moving into the future, it's 2022. Do we still need to be allowing pollution on our soil? The people in West Seattle don't know that what they're buying at Home Depot is toxic. Okay, I'm sorry, Home Depot, but you know, ironite, we figured out ironite was mostly lead. Okay, people were causing superfund sites in their little vegetable garden. And I mean, Home Depot didn't know, you know, it was allowed. You know, buyer beware, but also, you know, so we have this company called PCC, Puget Consumer Co-op. They have been doing research. When you shop there, you pay extra money, but you know that you're not going to get contamination. But you don't get that at any other company that I know of. And so, and it's really unfortunate because, yeah, people poison their soil here in West Seattle, and now they're getting sick when they eat from their vegetable gardens. Lead, for example. So look, why are we not capable? So I would like to see, if in my world, all the retired people that, you know, have even just 1 hour a day would invest some time into this, into finding the solution to the greed. Right. I have a lot of people, when they get older, they have money, right? They don't need to be greedy. So they could spend time addressing the issues of greed. But that's just came to me.
Well, you know, you raised a really good point. You started out by saying we need to take care of these companies, these parks, these Superfund sites. And it's very true that they're not, you know, there's two sides of that. One is just the basic sides of cleanup, taken care of by cleanup, but there's that other side, I think, that maybe you're also speaking to, is actually to take care of those institutions, the companies, the people who have the influence of whether to pollute, whether to clean up. And, you know, when, you know, a company is in a, I need to make profit mode, it feels scarcity, you know, and it's not thinking about the cleanup. But the more that we can be actually supportive, you know, find ways of being supportive, you know, what can I do to help you do the right thing? I think the more people in a position of power who, you know, maybe right now in that mindset of greed might open up to other possibilities, other ways of doing things, of taking a little bit more action if they feel supported as well. So, you know, it's, you know, I know that we have this urge to just kind of lash out at people when we hear an injustice, but we need to find ways, especially if somebody has that extra time, they're retired or whatnot, to show up and say, how can I be supportive, whether it's, you know, through resources or my time, to help you move into making better decisions.
Yeah. Well said. I always love speaking with you because you help me get everything in one short paragraph that I'm thinking. Police officer, bringing again this police officer into things, right? He's a moderate. He's not a Democrat. He's not a Republican. He's saying, well, people who speak, who talk a lot, who, right, they talk about all these things that need to be done, and then they don't stick around for doing them, right? So don't waste your energy. Don't waste your energy. Just hold, you know, hold these thoughts and see, where do you want to make the difference? You know, where do you want to just help that one person down the street who's taking his waste from the, you know, what do you, the Winnebago, right? They collect their waste, their you know, poop, and all it is poop. You know, what big deal, right? Why not just dump it right into the creek? once a week, maybe you can make friends with just one person and make a huge difference to the fish right there.
Yeah. Yeah. Show someone how to compost, then they don't need to buy those chemical fertilizers at Home Depot.
Right. If you're really into composting, learn about compost, or you already know about composting toilets. Offer those services, whatever you know.
Yeah.
You do know enough right now to make a difference in the world.
Yeah. I like what you said there about, just go ahead and take action. You don't have to sit around in those committee meetings and talking until you're too tired to do anything anymore. Yeah.
Yeah.
Very true.
And, I want to save the world, right? You wrote a book that you want to reach as many people as possible and help the world. And I think if everybody just calmed down and just slowed down, actually that slowness, that, believe it or not, the 17 hours that you're sleeping is probably doing a lot for the world, that because in the hour that you're waking, you're there, you're present, okay, we need to heal. Yeah.
Yeah, Miranda, thank you so much for everything that you do. Again, I just feel like I owe you a lot, and that you opened my world to a greater understanding of what's possible in terms of healing, and then just the practical help that you've given me over the years, and always the insights and conversation about what you're doing, and opening my mind even further to those.
Well, I don't want to end just yet, because I just love talking to you, and I had to look at my notes, and I have the abstract here of something about thallium, and I probably shouldn't mention it now, but I will.
Go for it. Yeah.
So just randomly, thallium poisoning is one of the most complex and serious toxicities known to man. And the symptomatology, I'm just going to read you this. The symptomology of its toxicity is usually non-specific. So it's multi-organ. It's non-specific due to multi-organ involvement. The initial symptoms of thallium poisoning may include fever. And the reason I bring this up is because fracking has created this issue with thallium. And so the poisoning may include fever. How many of these have we had? Fever, gastrointestinal symptoms, delirium, convulsions, and coma. And symptoms appear rapidly, and most commonly the acute toxicity subsides to be replaced by gradual development of mild gastrointestinal disturbances. Polyneuritis. So there's all these big names. If you want to know what polyneuritis is, you just put it in Google. Nerve damage. Okay, just say nerve damage. Encephalopathy. Oh, damage that affects your brain. That's encephalopathy. It's a big word, but it's just a disease of the brain. Tachycardia, rapid heart rate, very simple, fast heart rate. Who doesn't have all of these things that have big words? Skin eruptions, we know what those are. Stomatitis. Stomatitis is just inflamed mouth, sore mouth. Atrophic changes of the skin. That sounds big too, but it's just thinning and drying and inflammation of your skin. Nail changes, Mies lines. Okay, these are lines that transverse. They're white bands on the nail that are commonly associated with toxic poisoning and severe infection. So arsenic and fluoride, as well as the thallium poisoning. Degenerative changes of the heart. Okay, how many people do you not know had heart problems until they got COVID and died? Okay, so the degenerative changes of the heart, we are seeing weakness in our people at younger and younger ages. Liver and kidney also degenerative changes. Subarachnoid hemorrhage, well, that's bleeding in the spaces that surround the brain. So that's like stroke. Okay, where have we heard that? Some people are more prone to this. Why are you more prone to this? So what I'm going to keep reading because it's interesting. Bone marrow depression, which is white blood cells, your immune system. Increased radio opacity radiopacity of the liver, which means that the liver is becoming dense and it resists the passage of X-rays, and that may occur. And then developments of psychotic behavior and hallucinations and dementia have also been reported. In humans, the most characteristic sign of thallium toxicity is alopecia, or hair loss, which usually appears in cases when death is delayed. So let's say you survive 20 days of thallium poisoning. So other signs and symptoms may develop at any stage of toxicity. I'm just giving this as an example that toxicity is affecting you, your friends, everybody you know, and that if you have a healthy system and you have people who are alternative practitioners who know what whole foods can help you with your body detoxing from these things, or minerals that help like zeolite, or other herbs that help with the body's detox mechanisms, you're going to see that you're not going to be as effective. But I want to help people who are suffering. I don't think we are, the fracking caused this. We need to stop the fracking. Okay. I think already it's being stopped, but why did it go so far? Oh, because we needed money. Somebody wanted, jobs. Are jobs really worth destroying our whole system of water? Everybody needs to be able to drink water, and to be poisoning well after well after well. In the future, we're going to look back and say, what are these crazy people doing?
Yeah. I think, it's interesting. You're talking about these, these health symptoms and where we are in the world and the future. And I think we are at a turning point because, you talked about our vulnerability, for example, to COVID. We are at a turning point where we can tell ourselves, oh, this is just a virus, it's some external force, or it's the Wuhan lab, or it's the pandolins, or whatever it is that we think. But we need to open our eyes to that. This is the fracking. This is the toxic chemicals in consumer products. This is the stuff in our fertilizers. These are the things. That's the underlying, that's the ecosystem that we're in, that's influencing how we deal with whatever comes our way, right? Yeah. And I really appreciate you're making that point of, we need to wake up. And is this our future? Are we going to deal with this? Because that is going to really determine whether, next year or 5 years from now or 10 years from now, we're going to be facing the same thing or something even worse.
Thank you. Yeah.
Yeah.
Oh yeah, laughter. It's just like, a great way to say we're in this and we're going to find solutions because we have to.
Yeah. Yeah. And so sometimes necessity, as they say, is the mother of all invention. But what's understated there is we change when we need to, and we need to, right? And thankfully I feel like I've had to change a lot, in my life. And obviously I had to change things that I was doing in order to align with my health. But we need people like you, Miranda, to give us that opportunity to transition, right? Because I'd be somewhere, I don't know what I'd be doing if I didn't help, right? I wouldn't have the opportunity to transition.
Yeah, part of me wants to, quit my job and go work for City Hall and, do that. And well, no, because I need help, and everybody who's on my side has been sick and needs to stay well. Yeah. And unfortunately, once you have a chronic illness, or fortunately, I don't know, no, it is unfortunate. Once you get sick, it's like eating, like every day it's making sure that you don't get that next toxic exposure. You're aware that, this is what you do today. Washing my hair with a shampoo that had those phthalates. Is that right?
Yeah, phthalates,
Yeah.
orange, yeah.
They're like plastics in your shampoo,
Yeah.
because it makes your shampoo smell like strawberry.
Yeah.
And now my hair smells like strawberry, but I feel sick. And I was, showing up a week later, and my colleague Josie Stewart here, who does, she's able body nutrition. She's like, Miranda, you have plastics in your system. Like, oh no, I just wanted my hair to smell pretty. And never using that shampoo again. I don't use shampoo. I usually just, wash it with soap, and then I use vinegar, because it's really good for gray hair,
And
and
what soap do you use? Because
I use a handmade soap that one of my patients made, because it really doesn't bother me, and it's and it has an essential oil in it that smells nice, but not too strong. But generally I use all fragrance-free soaps for hand washing. For my hand sanitizer, I just bought Everclear, and I put some aloe in it,
Love it.
and I
Yeah.
use Everclear in my office for myself, but I just use, fragrance-free soap to wash my hands regularly. As far as the masking, sure, the cotton isn't organic so I have to wash this a few times, and my ears are reacting to something, so I have to always be aware of the other masks have something in them that bother me terribly, so I don't wear those very often. But I'm rambling.
Yeah, no, I mean, I think it's helpful for people to know, right? Because you got to start thinking about, well, what am I going to do instead of what I'm doing now? I think that it can be fun. It can be really fun to explore different alternatives and options. And for people who, if you can see it that way, like, okay, I'm going to take charge of my health. I'm going to play around with it and talk to people and try things that people are making. It becomes fun because it can be overwhelming. But I do also, if you, for people who are interested in knowing, like, well, how do can my symptoms, be caused by exposure to things, chemical exposures, what are those connections? You brought up a lot of the connections between, already, from fracking, the toxic chemicals in fracking and the health impacts, but there are a lot of universal sort of connections between whether it's the phthalates or the different toxins in personal care products or conventional laundry detergents or random pesticidal products you might buy for your home or garden or whatnot. There are a lot of commonalities because those chemicals are toxic. They're toxic in your system, and so you probably I'm going to ask you to comment on this particular point, Miranda, because people have different ailments, right? Somebody ends up with numbness in their hands and somebody else is having fatigue, but they're all experiencing toxicity essentially from their environment, and there's a few things at play, but it's just that knowledge that somebody might tell you, and your doctor will say, oh, well, you have cancer, and they might tell you it's because you must have in your family, or we don't know why, you just ended up with cancer and whatnot. But it's not like you're helpless, and if you know these things, if you know where things are coming from, that's something that I really push for in my book, is to give people an understanding of where things are coming from, and the book Silent Winter. You feel a little bit empowered, but I think people still kind of struggle to wrap their heads around, well, why is it, if we were both, me and my whole, whatever, my friends we live near fracking, and I've got cancer and she doesn't, and he's got, whatever digestive issues. How is that all related? So I don't know. I know that's a question that's always in people's minds.
How is that?
How's that all related? How is it that
all related?
The people, can be exposed, we live in a similar environment, but we end up with different ailments and illnesses. How can we
I'll refer back to what I just read about thallium. It is non-specific due to multi-organ involvement. So your cancer may be in your pancreas because your pancreas, you're the kind of person who's always thinking all the time. You're always digesting thoughts. You need extra enzymes to digest food and constant thinking. So pancreas might be where yours goes. Or maybe you drank too much of your Everclear that you had around for your hand sanitizer. I don't care, you name it. What you just did, was probably worse for your pancreas. And then the person who has lung cancer, I mean, they didn't even smoke, right? They were juicing, they were doing all these healthy things. But you know what? You also have to have your life in balance. The vegan lifestyle is not necessarily the healthiest lifestyle. Surprise, surprise. You don't have all the B vitamins. Okay, maybe you're taking B12 pills, maybe you're not. Does that protect you? Well, is it a whole food B? Does it include everything else from all the 16 Bs that you get from eating liver once a month, like women used to do to stay healthy after their periods? No, you didn't eat food. Okay. So I'm seeing, quote, healthy people get cancer, because they're out of balance in some way. And it's not their fault, and it's not necessarily their diet. Sometimes it really was what their mother was eating or exposed to on the military base, many years ago. And if you grew up, if your grandmother grew up, downstream from a petrochemical company, and your mother was born there and you were born there, then your child is likely to also have cancer like all the other 4 women in your family, because you were downstream from a petrochemical company. Do you need to move? That's up to you. It's our choice whether we're dying sooner than our grandparents and our parents now. Okay.
Yeah, I found that in researching my book as well. And what you also said about younger people being sicker.
Yeah, I mean, I've never, when I was a kid, in orchestra, she had trouble holding her violin bow because, and this is in high school, she had arthritis. I'm like, that's not a disease you're supposed to have.
Wow.
And yeah, maybe she was eating dairy, and well, I was too, but maybe she was eating way more sugar and synthetic chemicals. So her liver wasn't quite as capable of all the detox that my liver was capable of doing. It took me until graduation from college to get chronic fatigue. From too many antibiotics messing up my gut, but what's that?
So I wanted to ask you, Miranda, about what you are seeing in young people. In my book, I talked about things that I found in the research, things that were publicized or that researchers looked at that they saw in young people. But there's a lot I know that doesn't show up in research, right? Like you see things every day. You see patients every day, practically. I know you've got now certain days, I think, when you might not be seeing patients, but essentially you are seeing lots of people. And so from that perspective, I think people would want to hear what is now the new norm. What are young people getting? Because I think a lot of people don't know, or they might feel alone. They might feel like, well, why am I'm 20 years old or I'm 16 or whatever, or even I'm 30 and I have this problem. Is that normal, or is it just me?
I'm seeing a lot of anxiety, but I had anxiety as a child. I had a family that was dealing with PTSD. My parents had survived World War II. So I mean, the PTSD that was transmitted to me from my parents was from war.
Sure.
But what I'm seeing now is, happy families, and the kids will get a skin condition, and the more stressed kids will have anxiety, and sometimes that's when we say environment, there's toxic environments, right, where parents aren't getting along. I mean, obviously try very hard to get along if you have children in the household. and get therapy, and get acupuncture to learn to regulate your system. And if something is stressful, just drop it. You don't have to eat perfectly. You don't have to do everything right for the environment. If that's something, you're listening to me. So obviously, if you're still here at how many hours in, 90 minutes here almost, you're concerned about the environment. So, you need to breathe and really focus on taking care of yourself. But what I see in kids, it's all over the place, but parents bring their kids in because of the ADHD.
Mm-hmm.
The parents bring their kids in because of skin rashes. And they bring their kids in because, asthma.
Mm-hmm.
I really help get that under control, but that's very much a whole food. There's so much I can do for these reactive airways.
Mm-hmm.
And there was another thing I was going to mention, and for some reason, depression.
Mm-hmm.
Yeah, we do have a more polluted world. So we have to have the tools to address it. I think West Seattle, there's such a mix of people here. We really kids will sprain their ankles. Kids, what do kids do? I don't see kids with hair loss,
Thank God.
thank God, right?
Yeah, but what you mentioned, the anxiety, depression, those are very common from toxic chemical exposure.
And
yeah, the research is finding large correlations between even air quality and mental health. So, very strong correlations between mental health and chemical toxicity, environmental pollution. And then for anybody who's done any kind of detox or has overwhelmed their bloodstream with toxic chemicals, even, that's loosened them up in other parts of the body, will know that there's a strong emotional reaction or loss of emotional resilience that comes from having these foreign toxins in your bloodstream. Yeah.
I have a patient, I think it's almost like a birth defect when you have a tongue tie, right? You've seen that babies have to have their bottom of their tongue cut, or the jaws are too small. When you don't have enough nutrition for generations, or maybe just while you're inside your pregnant mom, that you could develop a jaw that's really sunken in. So there are dentists now that are working with making the jaw a better fit for you. This is all like on hindsight, like it would be really important, to make sure that you aren't exposed to chemicals, that you are eating well during your pregnancy, that you're really prepared before you get pregnant with as much. And I love working with these women who are thinking about becoming pregnant, to make sure that they get what they need before they get pregnant.
Yeah, that's super important. Especially kind of in this world where our foods are not as nutritious anymore, and and then there's all these foreign chemicals that sort of interfere with our ability to absorb nutrients. It becomes so important to supplement and to do clean supplements and the right supplements. And then, that's true for anybody across the board, regardless of your age or man, woman. But, if you're a woman about to get pregnant, oh my God, yeah, just the importance of starting to supplement and getting ready for that process.
But also I identify the supplements that are not helpful. And so people will come with a lot of supplements that are too much, It's really much better to get this from
Mhm.
food, get this from food. I test them, take
Mhm.
this, get this from your food. Please get this from your food. And please, eat a chicken liver once in a while.
Uh-huh.
Eat a chicken heart once in a while. Not in a hot dog. No, no hot dogs. um, but know your farmer, and then also breathe and work really hard to be calm every day. Yeah, because ultimately, if you can learn how to calm yourself, you're taking away 50% of the problem.
Mhm. Mhm. And that goes back to that nervous system, that we started with. And I don't know whether we kind of made this point or really covered it at the beginning.
The
But
first thing
I
I
do
said
want
was acupuncture helps with post-traumatic stress.
Yeah,
You
but
know,
it's that, and that stuff happens because our nervous systems get stuck. And, I think we did maybe talk about this, but I just want to stress this for people that our nervous systems can get stuck in, in kind of a stress mode where we're not digesting, we're not taking in the nutrients, we're not even capable of, that muscle testing without that help and intervention, to get us in a place where we can sleep again and eat again, meaning absorb those nutrients and get energy out of our food, right? And have our organs and muscles and tissues function.
so find the person that you trust. Find a group of people that you can rely on if you get into that, when you get into that place, right? Your mother will die, right? Your father will die. And when that happens, are you ready to be able to breathe through the pain of that loss? And I know you went through that this year.
Yeah, find out.
And it is so hard for people to regulate, and have a system, have an acupuncturist or two on your staff, on
Yeah,
your side,
yeah,
to
you want
know,
that.
because things happen in life.
Mhm.
It's always happened, even before before petrochemical industry was here. We needed acupuncturists. We needed healers. We had mothers, we had witches, we had whoever it was. We had God, pastors, whoever you trust that can help you regulate, um, and really work to see the reality of what is happening in the world, and see where you can help reduce suffering for others. And I think that's where I'm
Mm,
going to end with
mm,
this interview, is this, where do you fit in to reduce not only your own suffering, but eventually the suffering of others?
mm, mhm.
Yeah.
Yeah, yeah, I love that. I feel like that's kind of, if that's all we did in this world, we would get so far. We would get so far. Yeah.
Thanks, Joanna.
Thank you, Miranda. This was lovely. I really had a great time doing this with you, and appreciate all the knowledge and being able to ask you some of the things that maybe we haven't talked about everything in the past, and there's still going to be a lot more. But I appreciate having those tools and resources from you.
Yay. Okay, well, I'll see how I can end this. I don't know how to.
Mm.
Talk to you later.
Okay. Take care, Miranda.
Bye.
Bye.